Hello, I'm Craig Peneff, Program Director of the Diagnostic Medical Sonography Program at Lorain County Community College. Diagnostic medical sonography, or more commonly known as ultrasound, uses high-frequency sound waves to create cross-sectional images of the organs and structures within the body in order to create images, and it assists in making medical diagnosis. And unlike X-ray, there are no known harmful effects from using ultrasound to its users or patients. The diagnostic medical sonographer, commonly known as an ultrasound technologist, is a healthcare professional that performs the ultrasound examinations. We work under the supervision of a physician, commonly a radiologist, but it could be a vascular surgeon, it could be an obstetrician, but we produce the images and we relay those images along with the patient's symptoms to that interpreting physician who renders the diagnosis. There are various specialties under diagnostic medical sonography. More commonly is obstetrics and gynecology, but there's also abdominal, vascular, and cardiac, as well as more advanced specialties such as breast, pediatrics, and musculoskeletal imaging. The most common use for ultrasound studies is, of course, to evaluate pregnancies and to look at the fetus to make sure everything is developing appropriately, and also to determine its gestational age to help estimate the due date. Other purposes for ultrasound is to look at the structures or organs within the body. We can look at the liver, the kidneys, gallbladder to identify tumors or cysts, gallstones, or various other pathologies throughout the body. We can also use ultrasound to look at blood flow in the vessels, to look for obstructions or narrowing of the vessels, as well as blood flow within organs or even tumors. Some of the skills required of a sonographer include basic nursing skills, because we're going to have to move and lift patients. We may also have to clean them up on occasion, and we always want to provide for their comfort. But we also have to be organized and have good deductive and logical reasoning skills, because we have to put pieces of a puzzle together to relay that information to our physician. We also need to have great interpersonal skills, not only to work with patients, but with other healthcare providers. Courses that are recommended to take in high school are as much math and science courses as one is able to take. The sonography program at Lorain County Community College is a 2-year Associate of Applied Science degree. Students enter the program or take their core courses starting in October or mid-fall semester. The program is accredited through the Commission on Accreditation of Allied Health Education Programs, or CAHEP, and we use clinical sites throughout Cleveland, Lorain, and Medina. The sonography program curriculum consists of several pre-admission courses that must be completed before the student can apply to the program. These include college composition, statistics, anatomy and physiology 1 and 2, as well as introduction to patient care, introduction to medical terminology, and the career explorations in diagnostic medical sonography. The introduction to patient care and the introduction to medical terminology are prerequisite courses for the career explorations in diagnostic medical sonography course. Typically, students can take the intro to medical terminology and patient care courses during the first 8 weeks of the fall or spring semesters, and then they can take the exploration course in the second 8 weeks of the fall or spring semester. The admission requirements for the sonography program are that one must have an overall grade point average of a 3.0, completion of all pre-admission courses and program support courses, which are the Physics 115, cross-sectional anatomy, general pathology, introduction to psychology or sociology, and lifetime fitness. One must also have to take an admissions test, which is the HESI A2 test, and have a minimum composite score of a 75. The applicants are evaluated according to how many of the support courses are completed at the time of application. If they have all the support courses completed beyond the pre-admission courses, then they achieve 4 points, and then those points decrease depending on the number of credit hours they have completed at that time. After the applications are evaluated, the applicants are ranked, and then we arrange for interviews during the spring semester. The applicants are notified if they've been selected for the program or not by the end of the spring semester. Those that are selected for the program are invited for an orientation session and registration at the beginning of fall semester, and then they would start their first sonography course the second 8 weeks of fall semester, which is mid-October. Several alternates are often selected each year. There is an exception petition that one may submit if they are completing some of the pre-admission courses during spring semester while interviews are being held, in order that they may also be interviewed for possible admission. The students should work through their advisor in order to submit the exception petition. Those that submit an exception petition would not earn points for any course that they are currently enrolled towards the application process, and would be considered after all applicants that have met the application criteria. Once the student completes the pre-admission courses, these are the other support courses that the student takes for the degree. They are strongly encouraged to have these completed prior to starting the clinical courses of the sonography program, as it's hard to work them in while they are doing clinical and labs. The physics for allied health sciences must be completed prior to starting any of the clinical courses, which is an accreditation requirement. Starting with the Introduction to Diagnostic Medical Sonography, that course includes 6 hours of lab a week, 8 hours of clinical a week, 2 hours of open lab, in addition to the 5 hours of lecture each week. And then they're also taking the ultrasound physics and instrumentation during that spring semester. In the summer semester, the students are taking the Imaging Modalities course and the Diagnostic Medical Sonography 1, which is abdominal pathology. That consists of doing 24 hours of clinical each week for 10 weeks. They also have 2.5 hours of labs, as well as 2 hours of open lab each week. In the fall semester of the second year, the students are taking the OBGYN pathology course, as well as a second ultrasound physics and instrumentation course. This semester includes 28 hours of clinical each week, 2 hours of lab, and 2 hours of open lab each week. In the final semester of the program, the students are taking the advanced studies and the professional issues. The advanced studies concentrates on vascular and pediatric exams. The students have 30 hours of clinical each week, 1 hour of lab, and 2 hours of open lab each week. Each semester, the open labs require that the student has someone to scan each week in the sonography lab to complete assignments. According to the U.S. Department of Labor, the mean salary for sonographers in Ohio was $67,730, which is about $32.56 per hour. Graduates have been starting around $28 to $31 per hour, which will increase as one gets additional registries. The outlook for diagnostic medical sonography is very good nationally, as they have projected a 17% increase in positions. The projected outlook of the Cleveland area is about 12% increase in positions. And I can tell you that all of our major facilities in the Cleveland area have shortages for ultrasound technologists or diagnostic medical sonographers. There are various career opportunities that exist in sonography. One can work as a staff sonographer or an ultrasound tech as they're performing the ultrasound exams, and may work in that capacity for the extent of their career. If one desires to advance, they may have to acquire a bachelor's degree or a master's degree as they get into a supervisor or administrator role. Several of our graduates have advanced to a technical specialist or an application specialist in which they work for the equipment manufacturer. In applying for the program, you need to apply to the college and make sure your high school transcripts are submitted and any transcripts from any other colleges that you may have attended. You would also need to complete the placement assessment test for writing and math skills. You would also want to meet with your academic advisor to make sure that you're taking the appropriate pre-admission courses and that you have completed the HESI test and all other application materials in order to submit that program application by February 5th. Thank you for your attention, and I hope that you found this informative. If you do have any questions, I encourage you to visit the program webpage and make sure you go through the Frequently Asked Questions tab, as it will provide some additional insight. You can also email me at cpeneff@loraineccc.edu. Thank you again, and good luck in your education endeavor.